Heart Failure in Pregnancy Part 2. Good morning and welcome to today's episode, where we learn about the causes of heart failure in pregnancy. Pregnancy puts the heart under one of the greatest physiological stresses of a woman's life. We learned this in yesterday's episode. For most women, the heart adapts, but for others, especially those with underlying heart disease, this increased demand can push the heart into dangerous territory, leading to heart failure. Understanding these causes helps us predict, prevent, protect, and provide safer care for both the mother and the baby. So, what causes heart failure in pregnancy? Number one, previous heart failure or low ejection fraction, less than 40%. This is the strongest predictor of heart failure in pregnancy. If you have an EF of less than 40% before conception, there is a major risk of decompensation. Prior heart failure episodes, higher relapse risk. Number two, pre-existing cardiomyopathy, dilated cardiomyopathy, hypertrophic cardiomyopathy, or cardiomyopathy secondary to arrhythmias. So if you have a pre-existing cardiomyopathy, there is risk of worsening during pregnancy. Number three, valvular heart disease. For those who may have rheumatic heart disease, valvular heart disease, stenosed, tight valves, or leaky valves, regurgitation, there is risk of decompensation during pregnancy. Number four, hypertensive disorders of pregnancy, preeclampsia, eclampsia, chronic hypertension, all these can predispose to heart failure during pregnancy. Number five, congenital heart disease. This is higher with women who have holes in the heart, septal defects, who have residual pulmonary hypertension. Number six, peripartum cardiomyopathy. This is heart failure that develops later in pregnancy, and I'll have an episode dedicated for this later. Then patients with arrhythmias. Arrhythmias are also a cause of heart failure during pregnancy. Atrial fibrillation, atrial flutter. So those are some of the common causes of heart failure during pregnancy. Who is at high risk of heart failure? Women, we have said, women with previously low ejection fraction, women with cardiomyopathy, women with valvular heart disease, congenital heart disease with pulmonary hypertension, chronic hypertension or hypertensive states of pregnancy, women with also twin and multiple pregnancy, women who are overweight, diabetes or severe anemia, elderly, women with pregnancies over the age of 35, or prior prepartum cardiomyopathy. According to the latest ESC guidelines on management of cardiovascular disease in pregnancy, prevention is the greatest, most important thing, and prevention should start before pregnancy. Preconception counseling is very important. The person with the above causes should be seen by a pregnancy heart team. The pregnancy heart team is composed of a cardiologist, obstetrician, anesthesiologist, and neonatologist. These ensure coordinated care of the mother with the underlying heart condition. Pre-pregnancy counseling is very important. Before pregnancy, we check your ejection fraction. We do risk stratification. Some medications will need to be changed. Early counseling and early protection. The delivery is planned. So all women with the causes listed above should have pre-pregnancy counseling. Remember, there is hope for every mother. With proper assessment, specialist care, and close monitoring, many women with heart disease can still have safe pregnancies and healthy babies. Awareness matters. Education saves life. Proper care gives hope to the whole team. Very important. If you have any of the causes listed above before pregnancy, have pre-pregnancy counseling. Your obstetrician, your cardiologist, some medication will need to be optimized so that the care is adequate before pregnancy, before conception. So stay tuned for tomorrow's episode, where we will learn, is it pregnancy or heart failure? How do you differentiate normal pregnancy symptoms like breathlessness from heart failure symptoms, which can also cause the same? Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.